So thanks again, Mary. I
Thank
appreciate
you.
you coming.
Thank you.
And look forward to seeing you back at the Y next week.
All right.
So in just a minute, we're going to have Heather Capabianca joining us. But in the meantime, as our guests transition, I just want to let you know about some other great stuff going on with the Y. Coming up on Saturday, June 29th, is the second annual Wild Y Mud Run. It's like the Warrior Dash and Tough Mudder and other great adventure races that you've seen out there. It's a 3-mile race with 20 different obstacles. You're going over walls and under things and through mud and through the water and carrying logs and all sorts of great surprises. But we had 500 people last year for our inaugural event. We're expecting about 1,000 this year. Check it out. It's going to be a lot of fun. And if the weather is anywhere near what it was last year, it's just going to be perfect. So we look forward to another fun time. So, Heather,
Hi,
thanks so much for joining me.
Thanks for having me on the show.
Yeah.
Appreciate
And so, what is the Connecticut State Office of Rural Health?
Well, that's a common question that we get. The State Office of Rural Health actually came about in 1994 as a joint partnership between the state and the federal government in order to promote access for health services and promotion of rural health issues. It's a federal program. We were housed initially in 1994 under the Department of Health in Hartford. And then in 1999, we moved to the Connecticut Office of Rural Health. Or to the Northwestern Connecticut, the office moved to the Northwestern Connecticut Community College. It's a federal program. It is entirely federally funded. And all of the states every state in the country has an Office of Rural Health. And obviously some are much larger than others, and certainly Connecticut has one of the smallest state offices of rural health, just based upon geographics and population.
Sure.
Yeah.
Well, we're certainly lucky to have the entire state office situated here in our own region.
Yeah, I think so.
So do we end up getting benefits because of that? Better service?
Well, what I have to remind people that we really do serve all of the rural communities in Connecticut, and there are 61 towns, rural towns in Connecticut, which a lot of people don't realize. Predominantly in Windham County up in the northeast corner, and Litchfield County in the northwest. So,
excellent.
Yeah, what we actually do, and that is we help to coordinate federal programs with state programs, with local programs, and one of our objectives is to prevent duplicating services and studies and programs, and I think we're pretty successful in that. We also provide a lot of technical assistance to healthcare providers who are trying to access grants, whether they be on the state or the federal level. So we provide a lot of that. We facilitate a lot of meetings between different providers, whether it be hospitals, long-term care facilities, communities, health clinics, VNAs, that sort of thing. We really promote a lot of collaboration and facilitate meetings.
So just in the name, it's focused on rural health. What are some key differences that, between rural health and non-rural?
Sure. Overall, I guess I should address first, in Connecticut, only 9% of the population here in Connecticut is considered rural, versus 20% on a national basis. And a lot of people don't realize that people who live in rural communities, they have more poverty, more chronic disease, less health insurance, and certainly an increase in provider shortages at all levels, whether it be dental, nurses, pharmacists, physicians, psychiatric services are seen less in rural areas. So that from a national level are the issues that we look at through the Office of Rural Health Policy.
Okay. So do you tend to work more with individuals or with organizations that serve individuals? We
do not work really with individuals unless it's to help connect them with an appropriate resource. We are working with healthcare providers.
All right, excellent.
Yeah.
And do you still find, my knowledge of your organization is relatively new. Do you still find a lot of people don't know that your office exists? And
Certainly, yes,
Yeah.
yes. Even though we have a website, we send out annual reports. One of the areas that people are very much aware of, we serve, and I should say we. I'm the director. I work very part-time in terms of the office. There's also a program coordinator because we administer a lot of grants. So we have a total of 46 hours in the office between the two of us. But we spend a lot of time attending different group meetings, whether it be with hospitals, with emergency medical services, with the area health departments, and we tend to be members or participate in organizations and groups and basically provide that rural voice to that organization and kind of raise our hands. Well, let's not forget that might not work in some of our rural communities, and this is what some of our issues are. So we bring that rural voice to a lot of different organizations.
excellent. You try and connect the dots.
Absolutely,
All right.
absolutely.
Now, what are some specific issues that you're seeing? Like, what are the current trends in rural health that you're really facing?
Well, the aging population. The aging population in Connecticut, we have a significantly aging population, quite a bit above the national average. The national average is 13%, whereas our aging population over the age of 65 is 16% statewide. In Litchfield County, it's 18%. So we're dealing with a lot of those access issues or those issues for seniors and elders that Mary was just talking about.
Sure.
How do we provide those services in the communities in which people reside? I mean, that's a big challenge for us in Connecticut and certainly for the country, but in particular, I would say for Litchfield County.
Yeah, and as the population ages with the baby boomers, the need is only going to explode.
Yeah. Access is always an issue, and when we talk about access, people can use that term in a variety of ways. We look at it in three ways for access. We talk about access whether a person has insurance in order to pay for their health insurance. Or their health care costs. It's also transportation. Can they actually physically get to where the health care is being provided? And access is also, do we have enough providers? Do we have a workforce where it's needed? And that's a challenge. We have a high number of physicians and dentists in Connecticut. We don't necessarily have them in the rural communities.
So when you identify those shortages, what's the next step to trying to come up with a solution?
Sure. We work very closely. In fact, a member of the primary care office, which is part of the Department of Health, and their focus is on recruitment and retention, identifying what are underserved, medically underserved areas, which may be geographic, which may be a type of demographic in terms of a particular illness, or it may be a particular age group. So we work with them. We act also as a clearinghouse when people are looking for employment in some of the healthcare fields. So we work in conjunction with the Office of Primary Care that oversees that at the Department of Health.
Excellent.
Yeah. And of course, we have the nursing program here now in Northwest Connecticut, which we didn't have. That's been a long evolution in bringing a nursing program to the community college here in Winsted, and that certainly supports the nursing needs in Litchfield County.
And I know my wife is a nurse, so I know that the nursing field is very cyclical. It goes from boom to bust. There's an overabundance of nurses, so then they stop educating nurses, and then you end up with a point where you don't have enough, and then it's almost like an overreaction every time instead of keeping that steady flow of professionals.
When the needs assessment was done for the Northwest corner to have a nursing program, one of the things that was looked at was the aging of the nursing population. Sure. And the Connecticut Office of Rural Health was very influential in getting a lot of that data, doing a lot of the surveys in terms of having data to support the need for the nursing program. And what happened is, as the nursing population is aging in this area, we got the program in, then at the same time, the economic situation turned so that a lot of nurses who would normally have been retiring 5 years ago, 3 years ago, are staying on for a bit longer in the field, either working part-time or just choosing to delay retirement. So there is that, as you say, that tug and pull right now in terms of a bit less number of openings than we had anticipated, but when we look at the trends and what the average age of nurses are in Connecticut and Litchfield County, the need's going to be great.
Sure.
And we'll be there to fill that need. We are there to fill that need.
Absolutely, and you've got that beautiful new facility to do it.
Yeah, it is great.
Now, so I know you mentioned you're part-time with the Office of Rural Health,
Yes.
so you also have another role at the college itself.
I do. I wear another hat, and that is coordinator of the non-credit allied health programs in the Center for Workforce Development. So those are programs like nursing assistants, hospital patient care technicians, pharmacy technicians, nursing, I think I mentioned nursing assistants, EMTs. We've also done advanced EMTs. We have graduated in the past 6 years, we've graduated 2 classes of paramedics. We continue with a lot of continuing education programs to keep up our competency levels of our allied health professionals. And yeah, we're doing a lot of things. We're graduating a lot of people.
And are you finding that the graduate of those programs are having good success moving on in their careers?
Absolutely.
Yeah. So there's a big need for those roles right now.
There's a huge need for that. There's a huge need. And particularly as, again, with our aging population, you know, we have an increasing need for really competent professionals that are working in the homes and working with our visiting nursing associations and our assisted living facilities, that sort of thing.
Yeah, there's a whole continuum of care.
Yeah.
And so there's something right for everyone.
Absolutely. You know, healthcare is a great field to go into, and you know, I've been a nurse for a long time and have only worked probably half of that time in what people would think is a traditional nursing role, and yet I've always used my nursing background in whatever job I've had.
Yeah, it's a great background to have.
Oh yeah.
And
Lots of flexibility.
absolutely.
Yeah.
And so what's your favorite part of your role?
I love working with students. I love providing them with career opportunities, ideas, helping them explore areas in healthcare that they would not have even considered would be an area. There's some great websites out there if people are looking in healthcare. Often when we think about, somebody says healthcare, well, why don't you go into healthcare? At high school level, they'll think, oh, either a nurse or a doctor, or a nurse or a doctor, or maybe they've had experience with an x-ray technician or something like that, but they don't understand the scope of practices that are out there in healthcare. And it's a very, very rewarding field. And with the emerging changes in healthcare, we're seeing a lot of things like telehealth is an emerging area in healthcare. Connecticut is probably a bit behind that compared to other states that are more rural, because I think a lot of it is the push for telehealth medicine is because of the need for special services. So what's telehealth? It's where you actually physically don't have to be next to your healthcare provider. You can communicate